Hi, I'm Dr. Dan from the So You Want to Be a Doctor podcast on medicalmastery.com. You could find me in iTunes. Today I'm going to give you a video segment that's a sample of the 1 hour and 8-minute audio podcast from episode 19. This was an interview taken with an active current graduate of my pre-medical course, the basic. And what we're going to discuss today is work-life balance in medical education. Both as a pre-med, how do you balance your time and schedule around family, friends, social life, and MCAT preparation, and do it adequately and efficiently. And more importantly, if you become so dedicated and engrossed with medical education that you're so busy in medical school, how are you ever going to kind of readjust your priorities later down the road and maybe get back to family or friends and the social life you started out with? That's what we'll be discussing. So in short, let's talk about work-life balance now. So as a medical student, if you're not in medical school yet, you may not consider yourself a medical student, but I would at least call you a pre-medical student, okay? And what I would suggest is that you start treating your undergraduate education and prerequisites and MCAT preparation as a career now. Start looking at yourself as a future physician now. So help solidify that commitment. We talk a lot about the levels of sophistication and pre-med commitment in this episode 19 podcast, the hour version. But I think a lot of us justify the kind of worship of work for medical education, for lack of a better term. You've got to commit so much time. There's no way to be as involved with your family when you're at the hospital all the time. Most of us cope with this by saying, I'm going to go through medical school, I'm going to go through undergrad, pre-med, hardcore, give 110%, to someday enjoy that dream. Whatever your dream is, maybe it's surgery or pediatrics, internal medicine, obstetrics and gynecology, emergency medicine, which was my first choice, etc., with the hope that one day your life can just magically balance out and you can be happy. This is a controversial topic. There are some happy people out there, but I don't think happiness is automatically built into the medical education plan, much less the stereotypical work and jobs that are offered out there often have you very overworked and overburdened in the current healthcare system. Having said that, I raise the point that, and so does Randy Freeman, who I interview in this full-length podcast at medicalmastery.com. Our point as an experienced, life experienced person, I'm a physician, is that if your priorities are now that work comes first, and then later after your training, maybe 5-10 years from now, 15 years if you're a high school student, then you'll adjust back to have a family and priorities. Our argument is that you cannot change your priorities that easily. It takes a life shift. By the time you get warped by the medical application or medical education process, rather, all of the idiosyncrasies, the pressures and demands of that life, it really helps form the young adults' mentality and ego, how they see themselves, how they fit in their career. A lot of them kind of feel guilty if they don't work full-time and just take what they're given. So if you're just a take-what-you're-given person and you're going to be a follower and not a leader, chances are you're not going to be able to just switch your priorities overnight, and you're going to be one of these growing statistics. The most recent one I read was 68% of women physicians in the United States reported they were dissatisfied with their employment choice, and that 28% or so would change their medical practice specialty if given the opportunity. folks, I think we need to have more input and control into what our careers look like. You do not have to accept the status quo, and for the most part, you don't really have to sacrifice your family to have a medical education. But I can tell you one thing: it may be a lonely journey. It's not the mainstream thing. The mainstream thing is to follow the pack, be overworked and overburdened, and even if you are home, you're either too exhausted to be with your family or you're preoccupied with work. So choose your residencies carefully, choose your medical school carefully, and I will tell you all about how to get work-life balance at medicalmastery.com. Go there right now, just check it out, sign up for the email list, and I'll send you my 53-page book for free, and I'll tell you about my Medical Mastermind community that's coming out on July 18th and 19th when I hold my first ever live web conference that's going to be a physical conference with individualized pre-med coaching, July 18, 19, 2009 in Texas. Okay, so you can check out all these events. It's too much to remember. I'll organize it all for you. Don't worry. Just go to medicalmastery.com and sign up right now.